In today's podcast, we're going over motivational interviewing for physical therapists, how to improve your communication skills. First and foremost, thank you. Thank you so much for your support. You truly allow me to do what I love for a living. My name is Dan Pope. I'm a physical therapist, coach, personal trainer, and meathead. This is the Fitness Pain Free Show, where we help physical therapists and coaches like yourself get your patients and clients out of pain and back in the gym where they belong. If you're watching this on YouTube, please hit that like button, comment, and subscribe to the channel. If you're watching this on the podcast, video, or audio, please leave a positive rating and review. It helps tremendously. If you want to go that extra step and really support me, consider subscribing to Fitness Pain Free Insiders. It's a comprehensive educational resource and toolkit for the fitness and rehab professional. Think Netflix, but for physical therapists and personal trainers. This is created by me and only me for the past 5 years or so, guys. I put a new lecture series in there once every month. I've been doing this for the past 5 years, so it's pretty big at this point. It's got over 100 webinars, ebooks, and complete guides. You also have the ability to reach out to me via a private Facebook group. So if you have any questions and if you want to answer it, you can reach out to me. And the best thing is it's only $1 for a trial for 1 week. After that, it's $12.99 per month. It's a recurring monthly subscription. But the amount of value you get in here is absolutely tremendous. I don't think you can find anything that's this cheap for just $1, right? So if you're looking to really support me, if you like this podcast, you want to see this continuing in the future, then please consider subscribing. So just head over to fitnesspainfree.com, click on the programs link, click on Fitness Pain Free Insiders online library. You get started for just $1. I'll also put a link in the show notes so you can check it out. So why are we talking about motivational interviewing? Dan, you do a lot of education about exercise technique, pathology. Why are we talking about speaking, right? And it's actually kind of funny because I feel really strongly about this, although this isn't necessarily my particular niche. And if you want to learn more about this, I recommend listening to some big experts in the field, and I'll give you some additional resources you can talk about. But here's the thing. Communication matters. And earlier on in my career, I really found this out, and I started to read as much as I can about things like emotional intelligence, motivational interviewing, because we have solid research now that shows utilizing motivational interviewing is going to affect our outcomes. Therapeutic alliance is going to improve patient outcomes as well. So if we're trying to get our patients better, the way we communicate to them is actually super duper important, right? And here's the thing. When I was in school, I actually did get a little bit of information about motivational interviewing. I remember doing a project on how to do motivational interviewing. And I remember when I was in school thinking, going through this information and then presenting on it for a project, that this is really important. And I feel like I should have been educated more on it. I understand as a university, you only have so much time to teach so many things. So it's just not always something that's on most students' curriculum at most universities. However, I think some students actually get some of this, but I learned a little bit about it. I wish I kind of learned some more. And then I started my clinical practice and I forgot all about it, right? And I get it. The students I work with now, when they do an initial evaluation with a patient, they're super concerned about getting an accurate diagnosis. They want to come up with a really good treatment plan, right? And they really need to create a really good treatment plan, right? The last thing in their mind is thinking about establishing rapport and delivering open-ended questions and trying to have this dance of a conversation that's going to improve patient outcomes. I think a lot of really good clinicians actually do this naturally over the course of time. They may not realize they're actually doing it. Okay. Again, this is something that is going to be developed over the course of your career. But the other part is that you can actually practice this, right? And there's parts of motivational interviewing that are easy to start to implement as a clinician. And over the course of time, you can really build and grow this to become even better, right? So as I spoke about before, we're starting to learn more and more. There's more and more recent research. So I quoted a few papers. There are 2020, 2021. So 2020 and 2021, very recent papers that show having better therapeutic alliance for chronic musculoskeletal issues, which is our bread and butter as physical therapists, is going to improve patient outcomes. So if I do the same exact thing as the person next to me, who's also a physical therapist, for the same exact pathology and similar people, I'll have better outcomes if I can just establish better therapeutic alliance, right? And I think that should be something that puts a light bulb in your head. You might start thinking like, oh gosh, if I can just build this therapeutic alliance, right, I can actually have better outcomes. So as a physical therapist, how do you build better therapeutic alliance? Well, motivational interviewing is one of the ways to do that, right? So you can get your patients better just by building better rapport, right? Kind of crazy, right? So another more recent study was looking at physical therapy plus motivational interviewing. And guess what happened? The group that had the motivational interviewing on top of the physical therapy, they actually had decreased pain levels, an improvement in functional limitations, right? And improved exercise compliance, right? And this might sound crazy. How can you get someone better just by communicating better? Well, I think for a variety of reasons. So the biggest one being is that motivational interviewing was kind of designed to improve a practitioner's ability to change someone's behavior, right? So if I'm a physical therapist and I want to get you out of pain, I have to show you how to get out of pain yourself. And I have to get you off your butt so you do the things that are important to get out of pain, right? And that's all about behavior change. Now, if I'm really, really good at the motivational interviewing process, then the research shows I can improve exercise compliance. I can get you to have more buy-in to actually do the stuff that I believe is really important, right? At the end of the day, this is actually a little, sad, but I could be the best physical therapist on the planet and I can get an awesome diagnosis and I can know exactly what's going to help you. But if I don't sell my process, my exercise interventions, my manual therapies, whatever it is, if I don't sell it well to you, then it's not going to matter because you're not going to believe in it. You're not going to go through with it. And you're not going to make that behavioral change that's going to get you better at the end of the day. So motivational interviewing, in my eyes, is one way to improve our outcomes because we're actually trying to change whatever that mentality is. It turns that light bulb on and says, I'm going to go through with this. I believe this provider. I believe this practitioner as a patient, and I'm going to go through the process of getting better, right? Very, very cool. Very, very powerful. So motivational interviewing, I already talked about a few of these things, but what does it actually do? So for one, you're establishing rapport with that patient, okay? And I think a lot of this is really going to rely on building a little bit of empathy for the patient. You're truly listening to them, and they're going to start to like and trust you because you're getting really good at listening, okay? Like I said previously, we're building therapeutic alliance, which is going to improve your outcomes over the course of time. We're helping our patients change their behavior, which is ultimately our goal at the end of the day. It's funny to think about it like this, but it's kind of like diet in my mind, right? So if you're trying to lose weight as a patient, right? So if you go to a nutritionist or a registered dietitian and you say, hey, I want to lose weight, the registered dietitian is going to tell you a bunch of things like you need to eat less, need to eat more vegetables, more fruits, less processed food. And I'll tell you what, that individual probably already knows that. Okay. When it comes to physical therapy, a lot of times that's the same. So patients come to you and they know that they probably need to exercise a little bit more and they probably need to back off of certain things that are flaring up their pain or injury, but they haven't done it yet. Right. So your job as a physical therapist is, yeah, you have to guide them to do the right things. You have to tell them what the right things are. Right. But just like that person who's trying to lose weight, they know that broccoli is good. They know that lettuce is good. Right. You just have to change their behavior and get them to eat their broccoli, right? Get them to do their external rotation exercises so their shoulder gets better over the course of time. Okay. And we're helping people change their behavior. So at the end of the day, as a physical therapist, one of the most powerful things you do is you change behavior, and motivational interviewing is a way to do that. Okay. The other thing about motivational interviewing that I really like is that I think it makes you a better physical therapist because it allows you to truly understand what's going on with patients. Okay. And we'll go over how this works in the next few slides. But basically, you do a lot of things called reflecting and summarizing. So when the patient tells you a bunch of stuff, you just repeat that back to them. Okay. And what happens is that your patient will tell you whether or not you're understanding the situation well. Because sometimes patients aren't phenomenal at communicating everything that is important. right? So they're going to help guide you with your questions, right? So in the future, if you want to learn more about something specific, you can reflect to that person what you already know, and the patient can kind of tell you, yes, you're on the right track, or no, I think there's more information you need to know about. And that's going to change your critical reasoning over the course of time, hopefully improving your outcomes, right? So it's not just a matter of building this rapport, it's also getting more, better information so you can be more accurate in your treatment in the future, right? And lastly, it really builds that trust. So if someone is actively listening to you, right, and it feels like they truly understand, the pain problem they're telling you, that's just going to help build trust. And at the end of the day, that's really powerful in getting your patients better, right? So the next natural question is, okay, motivational interviewing. When does this fit into my treatment? Is this something that's ongoing? Is this something I do once, then it's gone? Well, generally speaking, it's going to be occurring at most in the initial evaluation. So when you first meet that person, right? So when you walk out the door to greet that new patient, that's when this process starts. Okay. And you do a ton of this early on within this experience for your patient. So in that initial evaluation, you're doing a lot of motivational interviewing initially, right? And that's to build that rapport. And over the course of time, you kind of switch from trying to establish that rapport and understand that patient, right? And develop that relationship towards actually treating that person, okay? And giving them advice, okay? It has to be done in that order. So if you go down that pathway of trying to treat that person right away, right, without doing the process of establishing rapport, you might not be working towards a patient's goals. There might be a bit of a disconnect between what you're trying to do and what the patient wants. And over the course of time, that can decrease your outcomes because you don't have that great therapeutic alliance, right? So you do this out of the gate. And it's very important that you start with this, okay? But the other piece is that it does continue throughout the rest of the experience with the patient. So it's not just the initial evaluation, it's your follow up visits, right? Oftentimes, when that patient comes back in, that first few, that initial dialogue that you have with your patients, like how are things going, right? It's moving in the right direction, right? You ask some of these open-ended questions, you reflect, you affirm, you do a lot of these things we're about to discuss. And over the course of time, it's kind of this dance. That's how it's been described to me. Motivational interviewing is a dance. So communicating is dynamic. So you're constantly getting more information. You're trying to tweak, change what you say, what you do is constantly changing based on some of these, principles we're going to talk about. All right. So let's get into this. So I want you to understand that the large majority of this information I've taken from one singular source. Okay. And I've actually read a bunch of books on motivational interviewing. Okay. And they're all very good. But the one that I really enjoyed the most was Motivational Interviewing by Bill Matulik. Right. I'll put that link in the show notes. It's going to be in the references. But it's, I read it in audio format. Okay. And it is super simple, easy to digest, and immediately applicable. So a lot of the resources that I've read on motivational interviewing, they're very scientific, which is obviously phenomenal, but it's not always immediately applicable. Bill Matulik's book was phenomenal. And really, I'm just regurgitating what he's taught me. And I've listened to this book 6, 7, 8 times. I actually just read it a little bit before I started recording this because I wanted to be kind of fresh on this before I deliver this information to you. But I highly recommend reading this yourself and then rereading it over the course of time. And the other thing about motivational interviewing, like I said, when I started my career, I was so absorbed in the process of getting the right diagnosis and treatment plan for my patients. I completely forgot about all these skills, right? And after I was 4 or 5 years into my career, I felt like I was now comfortable working on some of these tactics during my initial evaluation because everything else was kind of second nature. It was easier to focus on this. The other thing I continue to do a lot of and did a lot when I started with my motivational interviewing is reflecting myself. So after I do initial evaluation, I think about how that process went. Did it go well? Where wasn't it smooth? Where was some disconnect within the rapport building process? How can I improve in future visits? How can I improve in future initial evaluations? Just keep in mind, this is an ongoing process. It's not like you listen to me and all of a sudden you're an expert. This is going to be something you have to develop over the course of time, like any other skill. All right. But Bill Matulik, he talks about these 4 principles, right? And they are continuous throughout the entire book, right? And I am grossly oversimplifying motivational interviewing, but I'm doing this because I think it's important to actually consume and utilize, because as a physical therapist, there's a lot to think about. But he breaks up into these 4 powerful things you can do, right? With the acronym OARS, OARS. And these are open-ended questions, affirmations, reflections, and summaries, right? And you basically do this during the entire motivational interviewing process. Okay. We're going to try to go over these as you would with a patient that comes in to see you for the first time in terms of that initial evaluation. Okay. So the first portion we're going to go over are these open-ended questions. So what would be an example of an open-ended question, right? So let's say you have a patient that comes through the door. It's the first time meeting them. Okay. And you greet them. Oftentimes, I start my physical therapy examination with a little bit of rapport building, which a lot of motivational interviewing folks would say is not the way you want to start things. But I think it's really important to connect with the patient, say, how you doing? Where you're coming from, right? If I know the area that they're from, I say, oh, cool, Watertown, great place. I work with the local baseball team, blah, blah, blah. And I think that really helps to calm someone's nerves, right? And start to establish a little bit of trust, right? Let's say they're a CrossFitter and I'll say, hey, did you watch the CrossFit, open? Did you see this athlete? Did you see what they're doing, right? Automatically, it lets the patient's guard down. They kind of understand that I am someone who follows whatever they are coming in to see me for. So if they're into CrossFit, I'm into CrossFit. I think that's phenomenal. Once they get through the door, I start with these open-ended questions, right? So tell me why you're here today. Okay. And the reason why you start with these open-ended questions is because you are trying to understand why the patient is here today. Obviously, you want to try to diagnose the problem for these patients, right? But the patient is coming to you with a specific need, right? And they want to be understood and they want to be heard. And these open-ended questions are phenomenal for this. So basically, I'm allowing the patient to give me the entire reason why they're here today. Okay. I'm trying my best not to interrupt that individual while they get out everything that they need to say. Right. And I get it. If you're working with someone who's 75 years old, some of the Medicare patients out there are a little tough because they're going to talk your ear off. And if you give too many open-ended questions, you're not going to have time for the treatment, right? If you work with a bunch of youth, it's the opposite. You give a bunch of open-ended questions, right? And you're getting one-word answers no matter how hard you try, okay? So I think determining how many open-ended questions is going to be a skill, right? If you're doing this appropriately, you should have a nice, smooth conversation. The therapist should not be saying very much. The patient should be saying a lot. Okay. So you start off with open-ended questions. Tell me why you're here today. And over the course of time, they may tell you, and then they may start talking about their specific problems in the shoulder. And you're going to start with some open-ended questions that are a little bit more specific to the shoulder. So when did your shoulder start hurting? Right. And take me through the process of how it started hurting. Right. And then where you're at today. Okay. So closed-ended question would be, when did it hurt? But that open-ended portion is tell me the evolution of that. Right. So as you can see, that's a question that's going to start the patient off in a comfortable position, telling me the story of how that pain started and then how it progressed over the course of time. Right. The second motivational interviewing strategy you can use is the affirmation. Okay. So at the end of the day, you're trying to do two things, right? So you're trying to make behavioral changes in the patient that comes in and you're trying to establish rapport, right? So people like to be told that they're doing something right. Okay. It makes them feel smart, right? Makes them feel important, makes them feel like they're moving in the right direction. And it also makes them start to like you because you're telling them they're doing a great job. Who doesn't like a cheerleader, right? The other piece is that you're starting to push them in the direction that you want them to go. All right. So if someone comes in, let's say with shoulder pain, okay, or let's say with lower back pain, because this is how I have it written down, and they say, my back has been hurting, and I've been reading a little bit about how staying active is important. So I actually started doing a little bit of exercise. I've been going on some walks. I'm also doing some crunches, right? And in your mind, you might think, okay, well, let's make sure that your back doesn't kill when you stand and walk, right? And you have the type of pathology where maybe walking is good for you, right? But you don't tell someone right away, like, no, wait a second. Let's make sure you're not walking through something that's killing because you're trying to allow that person to speak. And at the end of the day, you actually want them to exercise. It's a good thing that they're walking. It's a good thing that they're doing some core exercises. Maybe crunches are not the best exercise for them. Maybe we have to evaluate and see. But the other piece is that they're actually doing a bunch of really good stuff. And we want them to continue doing these good things, right? And the other piece is that you're trying to establish this internal locus of control, right? So this is kind of a buzzword right now. We want to put the power into the patient's hands. We want the patient to feel like they can make the positive changes that are going to get them out of pain, right? And back to whatever activity that they're doing. So if they're doing a few things that's already pushing them in the right direction, awesome. Tell them that. Tell them they're doing a great job. Like, awesome. I'm so glad you're doing some exercise. You're actually going down the right path. All right. But continue speaking. I don't mean to cut you off. Right. So you continue allowing them to speak, but you affirm the positive things to continue pushing them in the right direction to make sure they're making those positive behavioral changes over the course of time. Okay. Let's bring up some more potential opportunities of physical therapy or physical therapists to kind of affirm someone's decision. So let's say a patient comes into you, and this happens very commonly. So they have some sort of pain problem, right? And oftentimes when someone has a pain problem, we know we have to take away certain things temporarily so they don't keep on perpetuating their pain problem, right? So let's say you have a runner, right? And they love to run, but whenever they run, they have this sharp stabbing pain in their Achilles, forces them to limp. So they're like, Dan, I love to run, but I'm having this sharp pain in my Achilles. So I actually backed off and I started doing more cross training. I'm swimming, right? And I'm also doing some elliptical stuff. In my mind, I'm like, phenomenal. That's awesome. You know what? Maybe we can get away with a little bit of running still. And we're going to talk about that a little bit later in the evaluation process, right? And I'm going to write that down in my notebook while they're speaking and just, make a note that, hey, I want to address your running later because maybe we're actually able to run a little more than you think you're able to, right? But immediately on the spot, I tell them, good, that's awesome. It's going to be important that we stay away from things that are super aggravating early on in your rehabilitation. But I also think it's phenomenal that you're cross training, you're continuing to stay active because these are all positive things. And again, we're trying to push these positive behavioral changes, right? I don't want to interrupt that person and say like, whoa, wait a second. You stopped everything. That's not good. You need to continue running, right? Because in my mind, I actually want them to continue running probably a little bit, but maybe a little less than they're already doing. But I don't want to stop them, make them feel stupid by telling them, I don't want to create this disconnect between, patient and provider where I'm disagreeing, I'm shaming them. That's exact opposite of what you want to do, right? I want to build this person up. I want to push those positive behavioral changes. And later on, if I think we need to tweak those behavioral changes, we will, right? But not in the beginning part, not in the very start of your initial evaluation, right? The other easy thing to affirm with patients is just the fact that they're through the door, right? It's really, really tough to make a behavioral change. And I think physical therapists don't understand this. Like as physical therapists, we're in a great spot, right? So folks generally have already made that decision that they want to make a change, right? They've gone to the physical therapist. Maybe they've been to their primary care physician first, or maybe they're coming to you as a first provider with direct access. But patients are already making a positive decision to be here, right? So as soon as that patient walks through the door, you can thank them. Say, hey, thank you. Thank you for your time today. I'm really happy that you're here today. And this is the first step towards rehabilitation. You're showing, a lot of positive steps just by being through the door today, right? So that's a great opportunity to affirm people coming in because in reality, we actually want them to continue coming in the future too, because that's going to allow us to help the patients more, right? So you can affirm them. And over the course of time, and we'll talk about this a little bit later, but this doesn't have to be just in your initial evaluation where you are affirming people's decisions, right? So as they come in for follow-up visits, if they're doing things appropriately, say, hey, you know what? I went to the gym and I did the exercises that you asked me to, but you know what? The curls, they felt really painful. The pain was like a 5, 6 out of 10. It was really sharp. So I just modified it a little bit. And I hope that's okay with you. I just changed the exercise a little bit and it felt pretty good, right? And you're like, oh my gosh, great job. You are a phenomenal physical therapist, right? You're figuring out how to do this. Good job. Give me a high five, right? Because they're making a positive behavioral change and you want to affirm that, right? Over the course of time, if they're not making the right decisions, we can obviously change those, but we want to make sure that when they have a positive behavioral change and they tell you that, you want to affirm that, okay? So what's the next positive strategy, very powerful strategy from a motivational interviewing perspective that we can do? The next one is going to be a reflection, okay? And reflections serve several purposes, right? So basically what a reflection is repeating what the patient told to you, okay? So let's say that you have a patient that comes in and they're starting down this process or telling you a story and there's a natural pause. As a physical therapist, you don't necessarily want to cut people off all the time. You want to allow them to speak, but if there's a natural pause and you can reflect a little bit, it does two things. So for one, you're going to reiterate what the patient just told you, right? And what we're trying to do is make the patient feel heard. Does the patient actually feel like you care for them? right? That you're understanding the problem, you're understanding how they're feeling, right? The other piece is that it allows me as a physical therapist, or you as a physical therapist, to start putting the pieces together. And if we're missing important elements, right, the patient should tell you this, right? So let's say a patient comes in and they've hurt their shoulder and they're going back on the history. They're telling you, hey, I hurt myself, doing this specific movement, but it wasn't that bad. I kind of continued exercising, right? And over the course of time, it got worse. So then I ended up going to see my primary care doctor, and the primary care doctor said, hey, I want you to rest a little bit. So I rested, and that actually started feeling a little bit better. I went back to the gym. I started doing this exercise, and it killed me again. So I didn't know what to do. I went back to see the doctor, right? The doctor said, hey, I want you to try some physical therapy, right? And the patient tells you all this. And we know what you do. You repeat it back to them. You tell them exactly what they just told you. Okay. Right. And what's kind of cool about this is that that's good for you as a physical therapist, because you can make sure you're getting all the pieces. But here's the other part. Patients aren't always the best communicators. And once they hear you repeating that, they can fill in the gaps. They may say, I forgot to tell you this, but the exercise I was doing that really killed me was overhead press, right? And after overhead press was really painful, I switched it over to bench press, and the bench press felt really, really good. And that's good information for me as a physical therapist, because I can say, all right, great. So looks like you already modified your overhead press. That's a good thing. And it's something we need to do in the future. So I'm affirming. And the other piece is that I'm getting more information that's relevant now. I can see that bench press feels a bit better. So in my treatment plan, I'm probably going to push some of these bench press exercises, right? So these reflections are very powerful for a multitude of reasons, right? And as the patient continues to go on with this interviewing process, we interject every once in a while to reflect, right? So I'm building more rapport, right? I'm showing empathy. I'm showing people that I care. I'm gathering more information. It's a nice natural process, continues over the course of time, okay? So I'm gaining data and I'm building empathy, right? And here's the other piece. I do this regardless of whether or not I feel like I have more data, okay? So if someone comes in and they tell me a whole bunch of stuff that makes me think, ding, 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 this person has X pathology, and I know they need to do X, Y, and Z, and I don't think I need any more information, I still repeat back all of this history, okay? Because I feel that that is super important to establish rapport, right? And you may say, that's stupid, Dan, you're wasting time. I don't think so. We're trying to improve patient outcomes. If I can get someone to really trust and believe me and improve that therapeutic alliance, that's going to improve my outcome. So what am I doing in this moment? I think I'm actually treating that person, right? I am giving them a treatment just by asking them, am I accurate with what I'm hearing from you? Okay. I see that as a treatment because I know that's going to improve my patient outcomes over the course of time. So I think it's important that you don't skip over this, even if you feel like you know everything you need to know from this patient in order to start your treatment process. Okay. And the other piece is that you can't assume, and we'll talk about this a little bit later, but we want to ask a lot of questions about the patient's goals. We have to fully understand the patient's needs over the course of time. And if we're jumping to conclusions, if I start applying treatment interventions before the patient is kind of ready to accept them, then that can create a disconnect between the patient and the physical therapist. And that can, actually make my treatment outcomes a little bit worse, right? Because I may not, as a patient, fully trust or believe in my therapist yet, and might not be ready to change, right? Might not be ready to take that next step and make that behavioral change over the course of time, right? And the last thing to focus on is going to be summary, okay? And really a summary is a larger reflection that is usually done towards the end of a motivational interviewing experience, okay? So I usually do my summaries at the very end of my physical therapy kind of interviewing subjective process. Okay. And what I'm doing is I'm taking all this data that they've told me, what I believe is the most important, right? That they've told me over the course of time. And I'm just reflecting, right? I'm just saying it over again. I'm kind of hitting all those bullet points about what's most important. Okay. Usually at this point, right, and I'm getting ahead of myself a little bit, I'll start asking about patient goals, right? Why are you here today? And this, again, these are open-ended questions that really allow me to build empathy, to see what the patient's needs are. But I'm going to do this towards the end of my motivational interviewing process. My patient will usually tell me their goals. And to be honest, oftentimes I'm already teasing out these goals throughout the course of the interviewing process, but I am trying to reflect and summarize at the end, and also meet the patient where they want to be met, right? Because sometimes I end up going through an entire interviewing process, at the end, I ask about the goals. In my mind, I'm like, well, that's kind of a silly, question. They seem to really want a good diagnosis and they want, good treatment, right? But they may tell me something that kind of hits me on the side of my head and says, you know what? They'll tell me like, hey, I went to a physical therapist before and they gave me a few exercises, but really what I was looking for is more, manual therapies or whatever it is. And this is important because we're trying to meet the patient's expectations and fulfill their needs. And at least for me, this is a great opportunity to reflect on what they've told me so far and get some more data on what they want from me specifically. And then at the end, I summarize everything. I put all this information together. I put this treatment plan together. I put together what I think is going to be best for them combined with what they want, right? And I think this kind of sets everything up to move positively in the future, okay? So the summaries are just the reflections you've had over the course of the session, right? That summarize well at the very end, okay? Lastly, one of the things Bill Matulik talks about a lot in his book is change talk, right? Because at the end of the day, we're trying to make behavioral changes in our patients, right? We want them to exercise more or to stop doing the things that are irritating them or to say, let's say, sleep better or manage their stress appropriately. All the things are going to get them out of pain and back to whatever exercise, activity, fitness that they want to get back to, or to get them to start some sort of exercise activity, whatever it is, right? And the thing is, they haven't started quite yet, although you can make the argument that going to a physical therapist is already starting. I think physical therapists are lucky in that we are dealing mainly with motivated folks. I am an out-of-network provider, right? I'm a cash-based PT. So the folks that see me are generally very motivated. So I don't have to push this as much as some other physical therapists might. But we want to try to figure out how ready people are to change, which you can ask them, like, how ready are you to start exercising? If I give you 7 exercises, how likely on a scale of 0 to 10 are you able to do those exercises, right? We start to figure out why haven't they started exercising yet? And we start talking them through that process. Well, can we do 15 minutes worth? Would this be okay? What would motivate you in order to get back to things? And they'll say something along the lines of, well, I'd like to be able to exercise because I love doing it. Right. And we kind of push that. We affirm that exercise is good. It's awesome that you want to get back to these things. And just the act of getting people to start talking about changing is very positive, right? We're trying to elicit these positive changes. So we want to ask about, why they haven't changed. What can we do to improve upon this over the course of time? Okay. So after you've gone through all of this, you can see the patient will feel very much understood. You'll have built some great rapport with that patient. You'll have shown empathy for them. And at that point, I think they're very, very willing to take your advice. Okay. And that's important. So all of this has to be done before you start giving someone advice. Okay. And I think one of the biggest problems the healthcare providers have, and we've all heard those stats, the average healthcare provider interrupts the person 3 seconds into, the first visit, right? Interjects, this is what you need to do. This is the problem. Here's the solution, right? I don't know that interrupting the patient is the problem. I think the problem is not building that rapport before you start giving someone an intervention. Okay. You want that patient to feel fully understood, right? You want to show that you have empathy for that patient. I've said this before. I love this saying: patients don't care how much you know until they know how much you care, right? Because at the end of the day, the treatment that you're giving this person, the person probably understands they need to do X, Y, and Z, but they haven't done it yet, right? So you have to really work on building that trust so that the patient will make that behavioral change. Okay. And I really think that's what motivational interviewing is all about. And again, it's not something that comes overnight. It's something that has to be practiced over and over and over again. And if you're a new grad and you don't really have your ability to diagnose down, right? The ability to create an awesome, plan of care and great treatments, get that hammered down first. And once you get confident with that, you can start to implement some of these things over the course of time. You can do some reflection. Hey, how did that evaluation go, right? Is there an area of disconnect somewhere in there? Was there a point where conversation didn't really flow freely, right? Or is there a point of disconnect where a patient kind of like lost interest or looks like they have that blank stare where they're no longer trusting anything I have to say, right? And think about how could I improve that in the future, right? In future visits or also future initial evaluations. Because I think what you'll also find is if you get really good at doing this, you're going to have more patients that come back again, right? Because that's important. So if you don't sell your patient on interventions and they go somewhere else where they don't believe what you have to say, they're lost, right? They're not going to improve simply because they don't believe you, and they're not going to go down that treatment pathway. Okay. So this art of selling, this motivational interviewing is very, very important. Okay. Guys, this is not the end of the learning experience. If you really like this and you want to listen to some more, I have a link for you to click right up here. So if you're watching on YouTube, click this link, right? If you're not watching this on YouTube, if you're listening to the podcast version, get on the YouTube version and click on that link, right? But I want to thank you for getting to this point. Okay. Thank you. Thank you so much for your support. If you're watching this on YouTube, please thumbs up, comment, and subscribe. I'd love to hear your thoughts. Do you use motivational interviewing with your patients? Do you think it's dumb? Do you think that we should be focusing on other things, right? Different treatments, different exercises, understanding pathologies better as physical therapists? How do we improve? How do we improve our patient outcomes? Is motivational interviewing one of those things that's important to you? If you are listening to this on the podcast version, give me a positive rating and review. Lastly, if you love this podcast, if you want to support me, the best way to support me is to head to fitnesspainfree.com. Click on the programs link. Click on Fitness Pain Free Insiders. It is $1 to subscribe for a weekly trial. After that, it's just $12.99 per month. It's a ton of great learning, and it's an awesome way to support me. If you want to learn more, you also want me to continue doing this. Okay. So thanks again, guys. I will see you on the next podcast. Later.